Hi, my name is Carolyn Rodriguez, and I will be covering fractures, exercise, and bones. Adult bones can grow due to exercise. Exercise will oftentimes stimulate bone remodeling. Bone remodeling basically causes osteoclasts to begin to destroy the bone, and osteoblasts begin to rebuild the bone. In other words, it starts creating a whole new cycle for that specific bone. And what happens is we tend to cycle within 7 to 10 years. We end up with a whole new skeletal structure. 500 milligrams of calcium can either leave or enter the bone matrix, creating a continuous cycle where the bone matrix can be replaced on a consistent basis. When the osteoclasts are stimulated, they cause resorption. They break down and destroy bone in order for the osteoblast to come in and replace bone matrix. This would be considered to be appositional growth. Specifically, this effect is seen when doing weightlifting exercises. When seen through a microscope, if someone who's doing weightlifting exercises, they'll often see that the bone remodeling has been stimulated. Osteoclasts increase in response to the stimulation, and osteoblasts come in to replace the matrix that has been taken out. It creates more collagen in the matrix, and creating more. See that a weightlifter will have thicker, heavier arm bones than you'll see in a jogger. The effects that this might cause in someone who is sedentary or out in space or bedridden patients, the osteoclasts will increase, but the osteoblasts will decrease. In other words, it will cause more bone deterioration. So the best choice in this scenario would be to find some form of exercise, specifically weightlifting. Any resistance will help in the process of appositional growth. Some recommendations by the American Heart Association are: they recommend 115 minutes of moderate to intense exercise or 75 minutes of aerobic vigorous exercise. They recommend to spread your workouts throughout the week, using weight for resistance in moderate to high intensity. They say move more and sit less, and make sure to do a lot of muscle strengthening. Compact bone on the outside, spongy bone on the inside to help them with the tension. And within the spongy bone, you'll see trabeculation stress. Bones have osteons, and they are basically cylindrical layers, and they go in opposite directions with the collagen fibers, and this will help with torsion stress. Is created to withstand axial pressure. Once you come in from the side, you can basically snap it into just like what happened right now. Some of the changes that you'll see during osteoporosis is that osteoclasts become more common as osteoblasts become less common. The body isn't making osteoblasts as much, so there's nothing to replace what has been taken away, what has undergone resorption. In other words, you're breaking down the matrix more and more until you have a weaker bone that can sometimes spontaneously just break. It will usually happen within the older population. When we're younger, we have more osteoblasts. Our bones are constantly reconstructing. As we become adults, that evens out. We have an even amount of osteoblasts to osteoclasts. And so we have a constant rebuilding of the bones. When you get into the older generation, that is when you see more osteoclasts. That is why you see a sudden drop in their in elderly bone mass. It is recommended for those with osteoporosis to take in an adequate amount of calcium, whether it be through supplements or through dairy, whatever works for them and what their doctor has recommended for them. Exercise is a main one, specifically weightlifting. According to orthoinfo.org, scapular fractures represent 1% of bone fractures in general. A lot of times what you'll see is that the older population will take a fall. If they have osteoporosis, their hips won't be able to support the fall, and that's why you see more fractures there. There's also a lot of moving parts in that area where the pelvic bone is. And if you have osteoporosis, the bone won't be able to withstand that trauma. Sometimes with a scapular fracture, you'll see a lot of cephalic and thoracic combination of fractures along with the scapular fracture. Thank you.